Hi, I'd like to talk to you about a service improvement project that we ran in Cardiff in the Vale, looking at the improvements in physiotherapy management of people with a hip fracture. We were lucky to be invited to the Trauma Hip Summit, which highlighted areas of improvement across the hip fracture pathway. It allowed us an opportunity to work as part of a big MDT, and this gave us an opportunity to look at how physiotherapy could directly influence patient care, but without an additional funding option. The aim of the service improvement project was to improve patient care following a hip fracture and to look at how we can improve prompt mobilisation after surgery and, importantly, improve joint working and education on the ward. To do the project, we used a PDSA cycle linking in with the ward managers, the surgeons and the anaesthetists. We also worked really closely as a team to map rotas and training and completed the paperwork needed to take the project forward. Before starting the project, we sent out a questionnaire for the multidisciplinary team to complete. The answers that we got back was that it was usually seen as a task for physiotherapy to do. They were unsure of the limitations on mobilising patients day one, and they were worried about encouraging the wrong mobilisation. So how did we do it? We implemented a 12-week pilot study called the Twilight Project, and we looked at one qualified physiotherapist working until 7:30 p.m. To see the patients, it would be done as a joint session with either a nurse or a healthcare support worker, and we had really great support with this. So we targeted the day zero patients on the theatre list that were back in time and any day ones who failed to mobilise that day. We also offered additional rehabilitation sessions and spoke to families and carers. The outcomes that we received were really positive. Out of the 46 patients we saw day zero, 37 of these patients successfully mobilised. We also saw patients on an average of 18 hours earlier than we normally would. This was really important for this patient group. We collected the CSP recommended 2 hours of physiotherapy, and these patients received that within the first week. As you can see here on this graph, we managed to have an improvement in our patients mobilising after surgery and peaked up to 95.6% in November. It also is worth reminding that we had patients getting up 18 hours earlier, which was a positive impact for our patient care and progressing on to different milestones. We noticed as an MDT that there was an improvement in all the KPIs during this time period where we all worked together and the ethos on the ward changed. We repeated the questionnaire following the study, and we had really positive feedback from the staff. It really changed the ethos on the ward, and patients were able to mobilise quicker and more successfully. We utilised a similar approach to what they used in electives, and this really helped with our patient care. It was really positive within the whole team, and the physiotherapy team really worked closer with the nursing staff. This is definitely something that has changed our approach to our hip fracture care and something that was quite easy to implement but had a really big impact and something very beneficial to try. Thank you very much for listening.